Cordial greetings, fellow Zimbabweans. We come again today on day number 3 of our national lockdown, just to give each other some advice and to see how we can survive this pandemic. Today we want to talk about myths, common myths that people believe about COVID-19. But before I go into that, I just want to bring you greetings from the People's President, Advocate Pastor Nelson Chamisa, and the entire MDC family. We say we are firmly behind government efforts to manage this COVID-19 outbreak, and we want to help in any way and every way that we can. So let's go straight into our statistics. Up till now, I believe from official government statistics that we have 8 cases, confirmed cases of COVID-19. And I want to point out that the first 4 were imported cases, but it looks like now what we're getting is community transmission within Zimbabwe. And the fact that somebody asked me yesterday, what does it mean that we now have 8 cases, the number is increasing? Well, it is a good thing that the number is increasing. Not that the number is increasing is good, but because it shows that we are testing a little bit more now. We have reason to believe that we have more cases than that in Zimbabwe. And in this time of lockdown, one of the measures that will help us to actually deal with the COVID-19 outbreak is to test as many suspects as we can and make sure that every suspect who is positive is properly quarantined and treated. That's how we are going to contain this COVID-19 outbreak. So we want to say to government, keep up those testing efforts, accelerate them. We are fully aware that there is no government on earth that has enough testing kits, that has enough personal protective equipment. Even the rich countries are struggling. But our government must continue to do whatever they can to ensure that we have more testing kits and we test more and more people. That's how we're going to fight this. So, of the 8 cases, we know 1 is deceased. So that's the first thing. The second thing I want to say is really a bit of good news, something to cheer up Zimbabweans. Our COVID-19 toll-free number, 2019, is actually working. I tried it yesterday, I called it, and somebody answered from the other end, and I got advice on COVID-19 on a patient on whom I wanted advice. So, it's working. That's a step forward. We congratulate the government for having a working toll-free number. Previously, I tried the 0800 numbers that had been given, and they actually did not work. So, kudos to the government for a working toll-free number. Let's go straight into our 2019 COVID myths. Our COVID-19 myths. The first myth I want to address is the issue of home remedies. There are many home remedies that have been proposed. Some people have said put lemon and a soda big together and you'll get a powerful concoction that will heal you. Others are saying take garlic, it will heal you. And there are many other concoctions that people are proposing for curing COVID-19 infection or preventing it. Let me tell you very plainly, don't waste your time, don't waste your money. Some of these concoctions are downright dangerous. Eat normal food. Garlic is normal food. There's nothing wrong with it. Lemons are normal food. But don't start making mixtures that you're not sure of. You may cause harm to yourself. At the moment, there is no home remedy and there is no known cure for COVID-19. There is no known chemical substance that can prevent you from catching COVID-19 infection. So that's myth number 1 about home remedies. Myth number 2, is there a cure for COVID-19? I've already answered that. No, there is no cure for COVID-19. Many cures have been proposed, but there are scientific processes that are followed before we as the medical fraternity adopt any cure. And those scientific processes have not yet been followed. So there is no cure for COVID-19 registered in Zimbabwe or in any other country that I know. Scientists are hard at work to find a cure and to find a vaccine for COVID-19, and this is work in progress. We hope we'll reap some fruits soon. Do hot temperatures prevent COVID-19? That's myth number 3. Some people think hot weather will protect them from COVID-19. No. It will not. There are many countries with very hot weather that are actually experiencing COVID-19 transmission within the country. Number 4, if I can hold my breath for 10 seconds or more, does it mean I'm free of COVID-19 infection? The answer is no. It does not mean you're free from COVID-19 infection. COVID-19 infections can be very mild. And if you have any symptoms suggestive of COVID-19, the only way to know is to get tested. What are the symptoms? Upper respiratory symptoms like cough, sneezing, sore throat, shortness of breath. And these symptoms, fever is an important part of it, coupled with a history of travel to a country that has COVID-19 and or contact with a person who has traveled to such a country, it makes you a suspect. Call 2019, find out how you can get tested and get tested. That's the only way you will know. Does alcohol protect from COVID-19? No, it doesn't. In fact, alcohol can be very dangerous to you. Taken in excess, alcohol does harm to health. So alcohol is no treatment or preventive measure for COVID-19. Number 6, does hot and humid weather protect against COVID-19? No, they don't protect against COVID-19. So we are just as susceptible as anybody else to COVID-19. Myth number 7, mosquitoes. Some people think mosquitoes transmit COVID-19. The answer is no. So far there is no scientific evidence that mosquitoes actually can transmit COVID-19. Myth number 8, do vaccines like pneumococcal vaccine or Haemophilus influenza type B vaccine protect against COVID-19 infection? The answer is no, they don't. They are pretty good vaccines. We still give them as part of our immunization program in Zimbabwe. They protect against certain types of pneumonia, but they don't confer any protection against COVID-19. Still get your vaccines, but you must know that you must practice the normal COVID-19 prevention methods. Wash your hands, wash all the time, make sure you wash, maintain social distance, avoid gatherings, and you will prevent COVID-19 infection. Number 9, can regular rinsing of the nose with saline help to prevent COVID-19 infection? The answer is no. Don't waste water on rinsing your nose. Spend your water on washing your hands with soap and water. That's what water is for. Number 10, we've already addressed the issue of garlic, and I just want to reiterate it because it's an issue that keeps coming up. It gives you a false sense of security. Garlic does not prevent COVID-19 infection. It has some antimicrobial properties, but it does not touch COVID-19 because COVID-19 is a virus. Number 11, does COVID-19 affect older people only? The answer is no. It affects everybody and anybody, including little children. But so far we've seen that severe disease has been noticed only in the older people because as you grow older, your immunity tends to get compromised. Severe disease has also been seen in people with pre-existing comorbidities like heart disease, asthma, diabetes, other forms of immunosuppression. But there is no one who is exempt from COVID-19 infection. It affects everybody. It is sad to hear that we had a 13-year-old boy who passed on from COVID-19 yesterday or the day before. And so you can see this 13-year-old boy did not have any comorbidity, and it's still puzzling doctors and scientists how a 13-year-old boy could succumb to this infection. Number 12, antibiotics for prevention and treatment of COVID-19. We want to emphasize that there are no antibiotics. Antibiotics don't work. Antibiotics work on bacteria only. They don't work on viruses. So we do use antibiotics after admission of a patient who is very sick into a hospital. If we think they've got a superadded bacterial infection, we use antibiotics to treat the superadded bacterial infection, but not the primary COVID-19 infection itself. It does not respond to antibiotics. Number 13, are there any medicines to prevent or treat the new coronavirus infection? The answer again is no. Let's prevent, prevent, prevent. I want to acknowledge the WHO for all the answers to these questions, which I've tried to answer. These are official answers from the World Health Organization. Let's take them seriously. The World Health Organization still emphasizes hand washing, very frequent hand washing. Don't touch your face. That's because you will transmit COVID-19 from surfaces to your face, to your mucosal membranes. Practice good cough etiquette when you cough into your elbow. Social distancing and staying at home. These are all important measures. And finally, the important measures which government must do, which we mentioned on day one, to make sure that we maximize on this period of lockdown. I thank you. We'll meet again tomorrow as we discuss another topic on COVID-19.